And this would basically, if this goes into effect, it would return the tax rates for people above $350,000 to what they were before 2000, basically. So it's a small increase and get back to 2000 rates. So that's how it's proposed to be paid for. He's sending us other ideas, and we'll see what happens as the debate continues. Next slide. Next slide. Let's get this one. Here's a really interesting slide that I was not aware of until I got into this debate fairly recently. What I found out is that we have a kind of a scandal right now. Well, we've known this for some time, actually. Washington State and some other states have done a great job in providing health care in a cost-effective way. Because our doctors and our hospital administrators and our nurses have found a way to provide us health care in a relatively cost-effective way that, frankly, the rest of the country has not. Let me show you how to know that. This is a slide in Seattle, Washington. We spend Seattle about $7,000 a year in Medicare. In McAllen, Texas, Uncle Sam has to shell out $14,500. And in Miami, Florida, we spend $16,300 for the same group of people with the same demographic situation, with the same disease, and no better outcome in these other cities. So what we have found is there are very substantial savings to be had and improvements in quality if we can find a way to do nationally what we do in the state of Washington. And what we have done, I am pleased to report to you that I was one of the 8 negotiators that negotiated from 6 hours till midnight about 3 weeks ago, a resolution of this. So in the bill that comes out of the House, there will be a provision that will fix this problem where Washington State is no longer disadvantaged because of this problem. So first off, for the people, if you receive health care through your employer and you're happy with your coverage, that's frankly most people in the country right now. They've got coverage and they're happy with their coverage. What does it mean? We got happy people here today. This is good news. It means you won't have to change your insurance or your entitled to keep your plan. Also means a very important point. A very important point. Everyone who has your health insurance today is paying a hidden tax of about $1,200 to $1,300 a year. And what that means is everybody who is paying for their health insurance or who has an employer who is paying for their health insurance, they are paying about $1,200 or $1,300 hidden tax, which goes to pay for the uncompensated care for all those 40 million Americans who don't have insurance. Because what happens is those people go into the emergency room, they get care, they don't have insurance, the hospital has to charge somebody for the cost, they charge everybody else who has insurance. So one of the goals of this proposal is to try to get more people into the health insurance program to reduce the premiums that we experience, and we hope to have that X% the cost of providing insurance for small businesses. It will also have an exemption for businesses below $500,000. In the bill, there is a requirement, essentially, for larger employers to contribute to their employees' health insurance, but not for businesses below $500,000 payroll. So it will be both a benefit and exemption for small businesses. Next slide, please. I'm a Medicare patient. How will this affect me? First off, it will finally close the Part D drug program. Yes. It's got some improvement in preventative care. We know that preventative care is not effective. And there's some other bells and whistles. Let's go to the next slide. I'm a mother of 3 with cancer. How will this affect me? First off, and this is something that I think is perhaps the most important thing in the bill, it will finally ban the insurance industry practice of rejecting applicants for treatment. We all think we're healthy forever. We're lucky in our health, but also temporarily disabled. I was riding, I got to go on a miracle bike ride this morning. It was a charity event called Bike for Pies, where I live over in Kitsap County. This morning I rode with a guy who's a miracle. He's a neighbor of mine, he's an ER room doctor, wasn't an ER room doctor. He was out riding his bike one day and a drunk hit him and rendered him a quadriplegic. And because of some extraordinary care, because of his resilience, he has regained a lot of his function. He can actually ride a bike now. And I got to ride with him. He's a miracle guy. He can't practice medicine anymore because of the injuries he has. And here's a guy who's well-trained, well-educated, dedicated, responsible doctor who today cannot get insurance. And it's just hard for me to believe that in America, we should countenance that situation. And I'm hopeful that legal passwords will encourage 97 to 98% of the people covered, creates a public insurance option. Basically low-income adults up to 400% of poverty that will basically say you don't ever have to pay more than 12% of your income for insurance premiums. So there's substantial subsidy. Let me say one thing about this. The public insurance option has become obviously a lightning rod for discussion. There's a lot of debate about it. I want to say just two things about it very quickly because I know there will be a lot of questions about it. Number one, now I'm going away from facts. I'm just sliding into an opinion here for a minute. My belief is that it just sort of makes sense that if we're going to require Americans to have insurance, it's not fair to foist insurance off to the tender mercies of the insurance market. But that it remain a choice, so Americans will retain their rights to make a choice. But here's a very important part of public option. I think it's important for those who are concerned about it. I know many are. Very importantly, the public option will not be like Medicare in the sense it will not be financed by federal fund dollars. It will be financed only by the premiums of people who decide to go into the public option. So it will not be a claim. Is that there is a provision that if you or a loved one, if you want to talk to your physician about end-of-life issues, what happens at the end of life, what medical procedures you have, what medical procedures you don't have. If you decide to do that, you have to...
No, it's not! Be quiet!
It is a choice. It is a simple compensation thing, and it all remains a choice. Next slide. Will reform health care benefits for illegal immigrants? The answer is no.